Hello my friends, I am Dr. Firuza Parikh. I am the director of the Well Women Center of Sir H.N. Reliance Foundation Hospital. I have with us today Dr. Trupti Mehta, who is a very senior consultant in IVF at the Well Women Center. Today we are going to talk on a very important topic which can affect many women. Almost 1 in 5 Indians are affected with polycystic ovarian syndrome, in short called PCOS. Dr. Trupti, can you give us a little idea of what is meant when we say that somebody has PCOS?
The condition of polycystic ovary syndrome, also called as PCOS, is, as we all know, increasingly prevalent today. The condition basically is the 3 important parameters which help in diagnosing this condition are: the first is clinical or biochemical features of hyperandrogenism, which means basically excess level of androgens, which is the male hormone in the body.
So are you saying that there is more of male hormones than female hormones?
Yeah.
Or is it an imbalance?
It is an imbalance, because of which excess of male hormones are present in the system and which can manifest in ways like acne, hirsutism, which is basically excess hair present in areas like face, chest, abdomen, thighs, upper back, lower back, and sometimes there is also a condition called as acanthosis nigricans, where there is development of dark thick patches on the skin, especially around the neck. The second important parameter to diagnose polycystic ovary syndrome is the presence of oligo or anovulation, which means either irregular or no ovulation.
So, is it that today there are so many young girls coming to us saying that I think I have PCOS. Many of them have little hair which they are worried about, and they also have acne because these are the growing years. Does that mean that they fit into PCOS, or is there some extra condition like you mentioned about oligo-ovulation or lack of menses coming regularly? What would constitute somebody being saying to say that yes, you have PCOS?
Yeah, so as per the latest criteria which have been developed by the societies all over the world, it is said that among the 3 important parameters, like the first one which I just mentioned was the excess male hormone resulting in hirsutism, acne. The second was the presence of ovulation, either irregular or absence of an ovulation. And the third is the ovarian morphology as seen on ultrasonography, wherein multiple tiny small follicles are seen in the ovary. Typically they are situated around the periphery, which cause a necklace-like pattern. So if 2 of any of these parameters are present, then these are criteria to diagnose the condition.
So a message to the audience is not every young girl has PCOS, because today girls, teenagers, adolescents are so conscious of their bodies, so conscious of how they look, that sometimes they think that they have PCOS and then they may start treatment which may not be necessary. Dr. Trupti, can you tell us what are the reasons for somebody being prone to PCOS or being labeled as PCOS?
Well, for PCOS, there are multiple factors which can be responsible. The most important being genetics, so wherein the condition can run in families where the sister or mother may also have a similar condition, or also against the very important factor of environment. Now, environment constitutes of our lifestyle and something which is called as the endocrine disrupting chemicals. Now, among the lifestyle, the very basics of include the diet, comprising of overeating or excess consumption of junk food, which could be high in calories, inadequate physical activity, which many women today work in offices where they are at their desk jobs, sitting for long hours at the desk or in the personal space, and of course the exposure to something called as endocrine disrupting chemicals. Now these also called as EDCs are something which we see in our daily life, and we are all exposed to it in the form of soaps, shampoos, detergents, paints, varnishes, plastics, to say the least, because plastic containers, and also the pesticides, in terms of pesticides which are used very commonly for vegetables. So when we are exposed to such EDCs over a period of time, these cause changes within our system, which can also have a very strong link to obesity and thereby also polycystic ovary syndrome.
So, one sort of a take-home message I want to give women who are wondering whether they have PCO is, it's not just your environment today. PCOS can be transgenerational, which means that it is what your mother ate when she was young, before you had the baby. So because of that, what happens, this transgenerational effect goes on from generation to generation. So the microenvironment and the macro environment of women are very important in having an impact on the future generation. Dr. Trupti, so far we have covered what causes PCOS, what is PCOS. Can you give us some words of wisdom about what one should do in terms of the lifestyle, in terms of prophylaxis, to try and that we can turn around this condition?
Yes, there is a lot that we can do, starting from the diet. To have a very healthy and balanced diet is a must, which includes a good serving of fruits, vegetables, nuts and seeds, adequate amount of physical activity, wherein a supervised exercise regime or even a simple walk which is done on a regular basis can really help in towards trying to prevent this type of a condition. Apart from that, exposure to EDCs, as I just mentioned, try to have a lifestyle wherein we minimize the use of plastics and cosmetics, and also try to use more of organically grown vegetables, can go a long way. Pollution has also its own way of and has a very strong link with this condition, but there is very little that we can really do about it. But wherein what all we can do is, of course, try to maintain a balance or an ideal weight and prevent any excess sugar. So there are certain insulin sensitizers like metformin which can be used to control the blood sugar levels, and avoid smoking, because that also has a very big impact on this condition. And in general, for obesity, there are some anti-obesity pills which could be used, and in worst cases, bariatric surgery can also be considered. As far as medical part of the condition is concerned, for fertility and for gynecological issues, women can be given progesterone and certain other hormonal pills which can prevent the occurrence of endometrial hyperplasia, which later in life can lead sometimes to an increased risk of endometrial carcinoma.
So please remember that the impact of PCOS is not just on fertility, but this impact can go on in later life. Obesity and all the comorbid conditions that go with obesity, like higher incidence of cardiac events, stroke, obesity itself, inability to move freely, affecting the joints, inflammation of many organs in our body. All this can have an impact on the way we live after we are menopausal, and therefore it's very important to look very sincerely at PCOS and treat the condition. Dr. Trupti, when we are dealing with women with PCOS who come to us for fertility solutions, can you summarize how we can help these women?
Sure. The first and most important aspect whenever a woman comes for infertility to us is to counsel her regarding the importance of an ideal weight, because this is something which women do not consider or give any much importance to it. They feel it is, it is a part of the process, does not matter. Weight is very, very important because it is proven that there is the probability of pregnancy reduces by 5% if there is per unit of exceeding the BMI of more than 29 kilograms per meter square. So weight loss cannot be stressed upon more. Second most important is these women can be given ovulation inducing agents like clomiphene citrate and letrozole and some injectable gonadotropins, which can help them ovulate. Once they start ovulating, their chances of pregnancy definitely will improve. Insulin sensitizers like metformin are simultaneously used as adjuvants to help control the ovarian dysfunction in these women. And thus, if needed, intrauterine insemination and IVF ICSI, in vitro fertilization, can help these women definitely aim and definitely achieve their goal of pregnancy.
Friends, we have tried to summarize what is PCO and how it can impact you. If you have more questions, you are welcome to visit us at the Well Women Center of Sir H.N. Reliance Foundation Hospital.